Hey everybody, this is Pamela. It's Thursday the 21st of May, and I already tried doing this video a couple of times today when it was a little bit brighter outside, so the lighting would be a bit better for my video, but it didn't want to work. So once again, please excuse the background. I've been folding clothes and there's like bags and stuff that I had my laundry in. It's all messy behind me, but at least I'm trying. Anyway, the reason I'm doing this video, other than the fact it should be like whatever, like week 30, part 1, I wanted to give you guys an update after my Tuesday doctor's appointment. Um, I don't know if all of you may remember from my last videos, but I really dislike the doctor I'm currently seeing. I've built up no rapport with him whatsoever, and him and his nurse are just increasingly ruder at every visit for absolutely no reason. I've been a good patient. I don't miss appointments. I'm never late. I never reschedule. I've even rescheduled for them when they couldn't take me one morning and saw him like 2, 3 weeks later than I should have. So that was kind of annoying, of course. Anyway, so I have a Tuesday appointment on Tuesday morning. And before the appointment, I was even contemplating canceling it because I just foresaw such a dreadful appointment. Because every single appointment gets worse than the last. I go in, and the first thing that happens is I ask my mom to come with me this time just so I can see if I'm actually crazy or if she notices how rude they're being, because this is the same doctor she saw for 3 pregnancies and the same doctor my best friend saw for 3 pregnancies. Anyway, the nurse calls me back, and I say I didn't bring the urine sample bottle, which they had given me 4 to 6 weeks before, so who's going to know exactly where the bottle is after all that time? And I said, but I can give a urine sample now if you'd like. And she's like, rolls her eyes, goes and digs out a bottle, hands it to me, and points to the bathroom. When I come out, I sit it on the desk next to the bathroom. It's like a little back desk right by the bathroom because she was nowhere to be seen. I go into the appointment room because she's nowhere to guide me. She's just gone. And then she comes running into the room where me and my mother are waiting. She goes, "Is this your urine that's been left on the counter?" And I said, "Well, yes, I just set it on the counter like you usually have me do because you weren't there for me to give it to you." And she goes, "Whatever." She walks away with a nasty look on her face, stomps off. The doctor comes in, doesn't even say hello, doesn't even look up. My mother says hello first, and then he's like, "Yes, hello, good morning." And he goes, "I see you haven't had your diabetic sugar test done." That's the test where you drink that big bottle of like orange, thick, syrupy stuff. And then they do your blood sugar test after that to see if you're diabetic. And it's an important test, and I am going to have it done. However, I have been procrastinating because the last time I did it in my last pregnancy, it made me very sick to my stomach, and I've been very sick to my stomach this pregnancy already. So the fear of vomiting at the doctor's office or at the clinic where you have it done and everything has just been making me nervous, and stupidly I have been procrastinating. Anyway, I said, "I'm very sorry, doctor." I said, "I will have that done immediately this week." I said, "I've just been procrastinating because of my stomach." And he goes, "Procrastinate all you want." He goes, "This is not my baby whose life you're threatening. It doesn't matter to me. Don't even have it done. I don't even care." And that's the exact tone of voice he used. And I was like, "Okay." I said, "But I'll have it done." He then has me lay down, measures my stomach where the baby is, refuses once again to tell me what my stomach measures, and it's not important. And then he did listen to the baby's heartbeat and said, "You have to be seen in 2 weeks by my colleague because I'm on vacation, and then you have to be seen in 4 weeks by me." He's like, go up to the nurse and have her book it. Bye bye. Didn't ask me how I was feeling. Didn't even offer me a hand to help sit up off of his little table. Um, anyway, I go up to the nurse, and he goes, "Have book these appointments for her." And she goes, "Sit down." And she points to the waiting room. She doesn't say, "Have a seat, please." She doesn't say, "Just a moment, Pamela." And you know what? That whole appointment from beginning to end was my absolute last straw. And trust me, guys, just so you know, I am not going to go to him just because he got mad that I didn't have the sugar test done. If he had been a little bit snarky that one time over that, okay, that's partially my fault for not having it done. But the rudeness of him and his nurse became too much on Tuesday, and I was like, I left there and I said to my mother, I said, "I will never go back there." Went up to my family doctor, who then told me, because my family doctor is a floor up from this OBGYN, he said, "People don't usually switch, they just don't do that." And I said, but I'm so uncomfortable to the point where I couldn't even imagine this doctor pelvically examining me, let alone delivering my baby. So I'm in a really difficult spot here. Like, if you suggest anything. And he said, and another thing, no other obstetrician gynecologist is going to even see you because they're all in his doctor group, and they will not see you because of political reasons, because they won't want to cut in on this doctor's turf. And I was like, okay, I guess everything's about the doctor's feelings, definitely not about the patient's anymore. Um, anyway, um, I then went home, not really knowing what to do, and I decided ultimately that my only other choice was to go back to the female doctor group of regular general practitioners. It's 3 women doctors, and they're actually the ones that delivered my last son, my third son, in my last pregnancy. They're the ones that you may remember me telling you about that were good during the pregnancy, but were very pushy with long-term birth control, such as IUDs, stuff like that. And it made me weirded out that they were pushing me so much to do that. But if I had to choose between a doctor who's pushy with birth control and a doctor who treats you like a piece of scum when you go into their office, I'll take the first. So we called over to this doctor group, and they said they would in fact take me back because I left on a fine note with them. It was just that I decided to go to this gynecologist this time, and we requested that my file be faxed over from the gynecologist's office, which they still haven't done yet. But the new doctor's office that I'm going to assures me that regardless, I can keep my appointment for the 3rd of June, and that's that. So it was a very emotional day for me. Like, I'm sure all you pregnant women out there know that when you're going to a doctor for all these months, you feel like you can trust in them, and you feel like that's going to be your safety net when you have this baby. And especially for me, I've had really difficult labors and deliveries, so I wanted somebody I could trust in. Anyway, give me any thoughts or whatever. This is the end of my video because I hear somebody screaming, "Mommy, mommy."